Hello everyone, my name is Talia Magoon, and along with my partner Ahmed Mirza, this summer we worked on our project of exploring grief in a modern context. Our community site this summer was Uplift Center for Grieving Children. They are located in East Falls with many satellite locations throughout all of Philadelphia. They offer free peer support groups for children and teens in the grades K through 12 who have dealt with the death of someone very important in their lives. They aim to help reduce the feeling of loneliness that a child can experience after someone dies. They do this by building access and connecting children and families to the resources they need, uplifting Philly, so being there for a community that has large amounts of trauma, violence, and grief, and by creating community and allowing peers to empower each other during grief group.
So much of the work that we did this summer focused on understanding grief, especially in the context of current events. We acted to help support staff by creating different materials for caregivers, children, and future volunteers. And we did this by completing different projects throughout the summer that helped educate. One of the things that we did was create a smoking cessation informative sheet. The sheet explained the negative impact smoking has on your health and listed various supportive services that will help people quit. And the end of the sheet also gave examples of alternative, healthier ways to cope with grief. We also created a racial trauma info sheet for future volunteers so that they can better understand how racism affects the people that they work with and their health. And lastly, we created a supplemental orientation video for future volunteers where we discuss important things that people should know when they work with those who are grieving, along with advice from a current caregiver. We included our perspectives and theirs in order to better prepare them. Here you can see some of the different projects that we worked on. The smoking cessation info sheet is the first two graphics that you see. The left side you see the various effects that smoking has on your health, as well as the resources available to help those who want to quit. The second graphic that you see, healthy ways to cope, offers alternative mechanisms of coping, including releasing the emotions that you're feeling in different healthier ways, talking about the people who died, etc. And then on the right side, you can see the infographic about racial trauma on the black body, the effects on mental health, on physical health, and just discussing trauma-informed care in general.
This summer allowed for a lot of reflection. The projects that we did this summer taught us the invaluable lessons of compassion and being there to listen to the people you work with. The overall health of a person involves so much more than just eating right and exercising. There are so many social determinants of health, such as socioeconomic status, education, community, environment, and more. It was so powerful to learn and understand how the current events, such as the pandemic and racial injustices, affect our community. It allowed us to understand better what people in our community are going through. Our site had a focus on grief, and we learned how everyone grieves differently, and every person you meet has a different story. A person is so complex, and they are more than just a person. You need to look at them as a whole entity and consider their entire life when working with them. Bridging the Gap showed us the similarities and differences between all communities throughout Philadelphia. In so many ways, we are all connected.
I agree with everything Talia said about the different lessons that we learned from our projects this summer. I'm specifically going to talk about one of the most impactful parts of our experience, which was the interview for the storytelling project. We interviewed a caretaker from Uplift, and she talked about her experience with losing a loved one, and it was very insightful just learning about how she navigated her grief in the context of the healthcare system, in the context of the pandemic, and it's very moving. And I think it provided us with a very valuable perspective that really conveyed some of the pain that comes with grief, as well as the need for compassion and for active listening when we work with people. And I think these are very important traits to carry into our professional careers when we work with patients. This project also helped guide us in developing the supplemental orientation video, which was discussed earlier. And hopefully in the future, people will gain the same insights that we gained from this interview and this storytelling project.